Welcome to Easy Treatment Healthcare Private Limited, your bridge to global healthcare. At Easy Treatment, our mission is to be your preferred healthcare partner, providing personalized and comprehensive medical assistance to patients worldwide. Our vision is to be a global leader in medical tourism, known for our commitment to quality, compassion, and excellence in patient care. At Easy Treatment, we cater to all patients, ensuring a seamless healthcare journey regardless of your location or background. Start with a simple inquiry. Contact. Visit our website for an initial consultation, where we'll understand your medical needs, preferences, and budget. We conduct a thorough assessment of your condition, discuss available options, and assist in scheduling appointments with top-notch healthcare providers in Hyderabad. Our dedicated team will accompany you to hospital visits, ensuring smooth communication with healthcare professionals. We provide continuous support throughout your treatment, from follow-ups to medication assistance. Even after your treatment, we're with you every step of the way. From post-treatment care to coordination of follow-up appointments, we've got you covered. Our comprehensive services include medical tourism, free medical assistance, appointment scheduling, medication and investigation support, second opinion services, and budget-friendly hospital selection. Our exclusive services includes organ transplant, joint replacement, robotic surgeries, neurosurgeries, heart and cancer treatments. For our NRI patients with parents in India, we go the extra mile. We support in carrying them to the hospital and ensure their safe return home. We welcome your loved ones with open arms, offering arrival support, airport transfers, and initial orientation. Experience hassle-free healthcare with Easy Treatment Healthcare Private Limited. Your journey to wellness begins with us. Contact us today at
Rishma from Easy Treatment Healthcare, and I would like to welcome you to the webinar Understanding Cataract Surgery, which is part of the Ask the Doc series of webinar. Easy Treatment is here to help you identify the correct medical specialist, provide empathy and support, and walk you through the processes, framework, and access point to care. If you want to know which treatment you can take, get advice through the Ask a Question platform or browse the service, everything is available on our website and can be accessible with a single click. Thank you for being with us. We extend a warm welcome to Dr. Advaith Sai Alampur, who has over 15 years of expertise in the field of ophthalmology. He is the founder and managing director of Sai Jyoti Eye Hospital in Hyderabad. In 2020, he completed advanced training in cornea and refractive surgery at Sankar Netralaya, one of the world's top eye care centers. He specializes in treating cataract, glaucoma, corneal issue, and vision problems using lasers, and he also performed ICL for severe vision defect and microincision cataract surgery for faster recovery and corneal transplant for complex cases. We are excited to have him lead this webinar. After the presentation, you can ask your question in your respective language. The doctor will give you clear and helpful answer, making this a great chance to learn from the expert. Please, doctor, you can continue further.
Thank you, Karishma. Is not getting the option of sharing the screen. I'm not able to share the screen.
We are checking.
If it's not coming, you can maybe present. I can just from your screen.
Okay. Sunny, please present the
Yes.
PPT. Just go ahead with the one slide.
Okay. You can start from the first slide.
This
Yeah.
is the
Good evening, everyone. I'm Dr. Advaith Sai Alampur, and I'm a cataract, LASIK, and a corneal surgeon. So today we'll be discussing about cataracts. And any questions, I think you can put in the chat box. I'll be more than happy to answer all your queries. So let us begin. So the objectives and the topics that we'll be discussing today, that first we'll understand what exactly cataract is, and we'll be talking about the early detection of cataract and why it is important to detect cataract at an early stage. We will be discussing about the various surgical techniques and how cataract surgery has advanced in the last 3 or 4 decades. And now after cataract surgery, the advantages are that you don't have to wear glasses. So we'll be discussing about the premium lenses and how these lenses can actually improve your vision and your day-to-day lifestyles. And I'll give you some important tips which will help you in a smoother and a quicker recovery post cataract surgery. And we'll also bust some myths and discuss about some facts about cataracts. And then later we will have a Q&A session. Or meanwhile, also you can put your queries on the chat box, and we'll be answering all your questions after the end of the discussion. So let us understand what exactly is a cataract. In Hindi, they say motiyabind. In Telugu, we say chuklalu or pora. Now, cataract is nothing but, let us understand that we all have a lens inside the eye. Now, the lens is basically like a camera lens. It is normally transparent. As we age, like how your hair becomes white, the lens also becomes opacified or it becomes cloudy. This is basically known as cataract. Now, because the lens becomes white, it does not let the light rays enter your eyes, which gives you a cloudy or a blurred vision. So this will basically impact your quality of life, giving you a blurry or dim vision that makes your daily tasks challenging. And cataracts are the leading cause of vision loss worldwide, especially in people over the age of 60 years.
Hello, Telugu sir.
So
Hello.
now, what are the symptoms of cataract? Now, initially, they might get a lot of glare coming from the glare, as in like when you're driving at nighttime, you see vehicles coming from the opposite, and you see a lot of glare from the headlights. You'll see the colors fade. Like for example, a bright red might seem like a dull red color or pink color. So color sensitivity reduces, and then you'll see the patients having blur vision or the cloudy vision. And so it is important that the cataracts are detected at an early age. And when you feel like any of these symptoms are there, like blurred vision, sensitive to light, glare, or if you feel there's a difficulty at night time or night vision is impacted, then it is best to go and meet your ophthalmologist. Now, causes of cataract, one of the main cause of cataract is basically cataract is age related. So it comes with age. So it basically will affect your eyes to almost everyone. And it can start around 40, 50 years of age, and it can progress when you're 60 or 70 years of age. Some patients who are diabetic
Hello.
or because of prolonged exposure to UV rays,
Hello.
we see cataract coming at a really early age. Smoking and alcohol consumption also can lead to development of cataract. Any trauma can cause cataract, and any genetic predisposition also is one of the causes for cataract. So let us understand what cataract surgery is. So initially, taking about 3 or 4 decades ago, we used to wait for the cataract to ripe, as in like we used to wait for the complete vision loss to happen, and then we used to plan for cataract surgery. But now that is not the case, because the cataract surgery, we do advanced procedures like the micro incision cataract surgery. We have the laser cataract surgery. Now, because of these, the recovery is much quicker. So it is really important that you get your cataract treated at the earliest. So who is at higher risk? Like I said, normally cataract starts slowly developing after the age of 45 years of age. However, patients with diabetes, or if there's any trauma to the eyes or any injury to the eye, lifestyle exposure, as in patients who are predisposed to a lot of exposure to UV rays, basically who are working in outdoors, any history of smoking or alcohol consumption, and any family history of cataracts are definitely at risk for cataracts. So there are different types of cataracts based upon the etiology, as in based upon how it is called. One of the most common causes of cataract is again age related. Like I said, cataract develops for almost everyone at a certain point of time. It could be after 40, 50 years or 60 years of age. So when the cataract is developing, we would recommend those of you who are above 40 years of age to get your eyes checked yearly once to rule out any cataract or any glaucoma or any other eye condition. Especially if you're diabetic, it is mandatory that you keep your sugar levels under control and get your eyes tested yearly once. Congenital cataract. Congenital cataract is a cataract which can present at birth or very early childhood. Like I said, cataract normally occurs at very old age, but congenital cataract can present at a very early age. So in such kids or babies or infants, it is important that the cataract is diagnosed and make sure that it is treated accordingly. Secondary cataract. Cataract can occur secondary to any steroid usage, or cataract can occur in patients who are diabetic. Cataract can occur at a really early age. Cataracts secondary to trauma because of any eye injury or because of any road traffic accident, cataracts can occur. And of course, because of radiation exposure like ultraviolet rays, cataract can cause at a really early age. Now there are advanced treatment options for cataract. Now the latest treatment for cataract is a micro incision cataract surgery. Now micro incision cataract surgery, where the incision size is less than 2.5 millimeter. The advantage of this micro incision cataract surgery is that the recovery is rapid. From within 24 hours post surgery, you can actually resume all your normal activities. And this surgery is done without the use of any injection. You don't require any injection, and we do it with only anesthetic drops. So once we keep the anesthetic drops, the eye becomes numb, and throughout the surgery, it normally takes less than 10 minutes. You can actually get back to your home on the very same day. And then we have the laser assisted cataract surgery, where the precision is much better for better outcomes. Now, the main important thing that I would like to discuss here is about the lenses. Now, before about 10, 15 years ago, we used to get only monofocal lenses. So basically, in a cataract surgery, what we are doing is we're removing the cataract and keeping a lens inside. Because we're removing a lens, we have to replace it with another lens. Now, the lens are of different types. We have the monofocal, we have the multifocal, we have the trifocal lens. So if you keep a monofocal lens, the distance vision a patient is able to see clearly. They might have to use glasses only for reading. But nowadays, nobody wants to wear glasses even after cataract surgery. So you always have an option of a multifocal or a trifocal lens, which you can discuss with your ophthalmologist, which you can opt for after surgery, where the advantage of these lenses are once you get the surgery done, you can actually see without the glasses, where even the near vision or the intermediate vision, that is your laptop, is completely covered, and you don't have to wear your glasses for lifetime. So the benefits of premium lenses, again, like I just discussed, it improves the vision at all distances, that is distance, near and intermediate. It reduces your dependency on the glasses. It gives you a sharper and a clearer vision post surgery. Now, we can just skip this slide we just discussed. Okay, so post-surgery care tips. It is important that once the surgery is done, you have to start using the eye drops immediately, and at least for 2 weeks, you have to refrain from any dust or water entering your eyes. So to avoid head bath and face wash for 2 weeks, but rest of the activities you can actually resume. Some people might be a little photosensitive post-surgery, so it is important that you wear sunglasses, especially when you're going outdoors. For 2 weeks at least, it is best to avoid touching or rubbing your eyes. And any weightlifting or gym or any other strenuous activities, you can slowly, once you feel comfortable, you can slowly start resuming such activities. So again, this is just a picture to show on the left-hand side, you see a normal eye and the lens is clear, where you can see the light rays are just entering your eyes and getting focused on the back part of your eye, that is the retina, which is giving you a clear vision. But if you see the right-hand side picture, as you can see the lens in the central part, which is the lens is cloudy. And if you can see on the eye on the image on top, that shows a cataract eye, you see the central part is cloudy. This is what a cataract looks like. But of course, this is when the cataract is in its end stage, where even a person or family members or friend can also make out. But then that is too late. Now, the reason why we normally ask people to get a cataract surgery when it is at an earlier stage is what happens is the longer you wait, the cataract becomes more and more dense, as in more and more harder. So it is difficult for us to do a laser surgery for the cataract operation. And sometimes when the lens becomes hard, the support also becomes weak. So basically in a cataract surgery, we are removing the cataract and keeping a lens inside. If the support is weak, then again, we might not be able to keep the lens in the same sitting. We have to wait for a month or 2 months. So that is why it is important to get the cataract surgery at an early stage. Normally, cataracts are in 4 stages, stage 1, 2, 3, and 4. Ideally, stage 1, 2, or 3 is a good time to go for a cataract surgery. So again, this is how it looks like. This is an intraocular lens, which normally is a foldable lens where it just goes inside a 2 mm incision, and once it goes inside the eye, it just opens up. And left-hand side, you can see is the cataract, the yellowish part in the center is the cataract. Now, this cataract is removed with the help of a probe, a phacoemulsification we call it. And basically, through a 2 mm incision, the cataract is removed. And through that 2 mm incision, a foldable lens is implanted. And it's a daycare procedure where you can come, get operated, and get discharged on the very same day. So lifestyle tips to manage cataracts. Now, sunglasses are not just for style purposes. It also protects, especially polarized sunglasses. Excuse me. So polarized sunglasses, it's always best to wear polarized sunglasses because it has a UV ray protection and it can delay the formation of cataract. Eat a healthy, balanced diet, especially diet rich in antioxidants. You can have any green leafy vegetables and lots of fruits like citrus fruits, like orange, sweet lime, and dry fruits like walnuts, almonds are very good. Get a regular eye examination, especially if you're 40 years and above of age. It is important that you get an annual eye checkup done, especially if you're diabetic. Again, it is important that you get an annual eye checkup done just to make sure that you don't have any diabetic changes in your eyes, which is called as diabetic retinopathy, which is again a serious condition. Of course, to refrain from smoking and limit your alcohol intake. And also, it is important that if you're diabetic, keep your sugar levels under control. So myths and misconceptions about cataract treatment. You can go to the next slide. Yeah, so the importance of early intervention is like, I think we just discussed this, to prevent further vision loss, because early treatment helps maintain the vision quality and to improve the surgery outcomes. Timely intervention leads to better surgery results. To enhance the quality of life, clearer vision basically enables independence and daily activity. And early detection, like we just spoke about, if you're detecting it in early stage and getting the treatment done, then there's less risk of any complications happening. So yeah, these are the myths. First one is, I think most of this we'll discuss, but we'll just go through this again. Only older adults get cataracts. No, that is not correct, because like we discussed, there is something called as congenital cataract, where even kids or infants or babies at an early age can develop cataract. Now, who are diabetic can develop cataract at early age, and who undergo trauma or any injury to the eye can also develop cataract. Number 2, cataracts need to be ripe for surgery. Again, we've discussed this. It should not be ripe for surgery, because the longer you wait for the cataracts to develop, the longer you wait for the entire vision to go down, then the higher the chance of complications. So it is very important that the issue is addressed as quickly as possible. So you please whenever you feel any blurred vision, it is important that you go and meet your ophthalmologist. Cataract surgery is painful? Absolutely not. Cataract surgery is a painless surgery. Ideally, we do a cataract surgery without any injection. We can just put anesthetic drops. The eye becomes numb, and throughout the procedure, the patient will not feel anything. In case we feel the patient is not cooperative, we can just give a local anesthesia, which again is painless, so patient will not feel anything during the surgery. Cataract surgery has a long recovery time, not at all. The advantage of cataract surgery is it is a daycare procedure. You can come, you can get operated, and you can leave on the very same day. And from the very next day, you can actually resume all your normal activities. So it has a very quick recovery time. So yes, if there are any questions, I think we'll be more than happy to answer all your questions. And thank you, Karishma, and thank you, Easy Treatment.
Hello, how much is the cost for the surgery?
Sir, basically surgery in cataract surgery, the laser surgery in any hospital starts around 20 to 25,000 per eye, sir. And basically the surgery, it varies depending upon the lens you opt for. So it can go up to 1 lakh from 20,000, depending upon the lenses.
Okay, thank you. Thank you.
Welcome, sir. Does Oculist eye drops help prevent cataract? No, Oculist eye drops is just an anti-allergic eye drops that will not help prevent cataract. In fact, there are no eye drops that can prevent cataract because cataract is an aging change. Just like how your hair becomes white, cataract is bound to happen at one point of time. So nothing will prevent cataract from happening. You can just maybe follow good balanced diet, take some antioxidants, which might delay the formation of cataract, but it will not prevent cataract.
Sir, what is the phaco surgery? The technique, how it works?
Sir, basically now cataract surgery in the last 15 to 20 years is only phacoemulsification. Phacoemulsification basically means it is an ultrasonic energy which basically breaks down the cataract into smaller pieces and it just sucks it out through a small 2 millimeter incision. So we make a small 2 millimeter incision, which is called micro incision, and we insert the phaco probe, where the ultrasonic energy basically breaks down the cataract into smaller pieces and removes it. And then through the same incision, we inject a foldable intraocular lens. That is a phacoemulsification surgery, sir.
Okay, thank you. Thank you.
Welcome.
Hello, sir. Telugu, sir.
Sir, చెప్పండి సార్.
సార్ మాది విశాఖపట్నం డిస్టిక్ అండి.
సార్
విశాఖపట్నం డిస్టిక్ అంటే పద్మనాభ మండలం, పద్మనాభ నుంచి మాట్లాడుతున్నాను.
సార్ చెప్పండి.
హలో
సార్ చెప్పండి సార్.
సార్ గత నెల 6వ తారీఖుని రైట్ సైడ్ ఐకి సర్జరీ చేసుకున్నాను సార్.
సార్
అది ఇప్పుడు ఏమైందంటే సార్, ఇప్పుడు సర్జరీ చేయకముందే కనిపించేది సార్, సర్జరీ చేసే కనిపించలేదు సార్. ఎందువల్ల అంటారా?
సార్ అది అంటే ఒకసారి చెకప్ చేయించుకుంటే అంటే ఒకసారి చెకప్ చేయించుకుంటే
3 టైం అయిపోయింది సార్ చెకప్.
ఏమని చెప్పారు సార్?
వాళ్ళు ఏమంటున్నారంటే కార్నియాలో వాటర్ ఉంది, అందువల్ల మీకు పన్ను అయ్యి మళ్ళీ కనిపించడం లేదు అని అంటున్నారండి. రైట్ సైడ్ కెట్రాక్ట్ సర్జరీ చేసుకున్నాం సార్.
అంటే కార్నియానా రెటినానా సార్? రెటినానా?
రెటినా సార్ కాదు సార్, కార్నియా.
సార్ ఇది అంటే ఒకసారి నేను నా ఈమెయిల్ అడ్రస్ షేర్ చేస్తాను సార్. మీకు తర్వాత మీకు టైం దొరికినప్పుడు ఒకసారి నాకు మెయిల్ పెడితే రిపోర్ట్స్ నేను మీకు ఇమీడియట్లీ నేను రెస్పాండ్ అవుతాను సార్. అది రిపోర్ట్స్ కూడా నేను చెప్పలేను
సార్. మెయిల్లో పెట్టడం రాదండి, ఇది వాట్సాప్ లో.
సరే వాట్సాప్ మీరు ఈ నంబర్కి వాట్సాప్ చేసేయండి సార్, వాళ్ళు నాకు ఫార్వర్డ్ చేస్తారు. షూర్ సార్. మీరు ఈజీ ట్రీట్మెంట్ వాళ్ళకి వాట్సాప్ చేయండి. ఐ థింక్ యూ కెన్. ఈ నంబర్కి వాట్సాప్ చేయండి సార్, మీకు ఫాలోఅప్ చేసుకుంటారు సార్.
సార్ అది 3 టైం అయిపోయింది సార్. డ్రాప్స్ కూడా ఇచ్చారు, డ్రాప్స్ కూడా కంటిన్యూ చేస్తున్నాం సార్.
ఒక్కసారి నాకు రిపోర్ట్ వాట్సాప్ చేస్తే
సార్ వాట్సాప్ పెట్టమంటారండి అయిపోయాక?
ఒక్కసారి నాకు వాట్సాప్ పెడితే నేను చూసి చెప్పగలుగుతాను సార్, చూడకుండా నేను చెప్పలేను.
ఓకే సార్, ఓకే సార్, ఓకే సార్, వాట్సాప్ చేస్తాను సార్ అయితే.
प्लीज सर. ओके सर.
सर ये पूछना था
सर.
Sir, what is AI assisted surgery?
सर AI assisted surgery अभी तक कुछ आया नहीं सर. It is just a gimmick. There's no AI assisted cataract surgery yet. Cataract surgery is still performed by the surgeon itself. So still in cataract surgery there is no artificial intelligence.
Okay, and how much approximately it costs for trifocal lens?
Sir, trifocal lens, there is Indian trifocal and imported trifocal. Indian trifocal costs you around 50,000 sir. Imported trifocal can cost you around 90,000 to 1 lakh sir.
It is included surgery cost?
Everything included sir. It might vary here and there, plus minus 5,000 from hospital, but approximately is what I'm telling you sir.
Okay sir. Which machine you use?
Sir, different hospitals have different machines sir. But the surgery will be remain. Welcome sir.
Thank you.
सर ये पूछना था. हेलो जी सर, आवाज
पूछिए सर.
कह रहे सर जो बच्चे होते हैं जिनको कंजेनाइटल कैटरेक्ट होता है तो उनका किस एज तक सर्जरी करा लेना चाहिए?
किनको सर?
जो छोटे बच्चों को मोतियाबिंद हो जाता है,
अच्छा.
जैसे जन्म से मोतियाबिंद हुआ तो उनकी मिनिमम कितनी एज से सर्जरी हो सकती है?
सर अगर मोतियाबिंद के वजह से इनका रोशनी थोड़ा कम दिखने लगा है तो सर्जरी इमरजेंसी है, जितना जल्दी हो सके करना पड़ेगा, क्योंकि अगर सर्जरी टाइम पे नहीं करेंगे तो उनका जो नर्व और डेवलपमेंट है पूरा नहीं होगा, तो जितना जल्दी हो सके ऑपरेशन करना पड़ेगा.
जिन बच्चों में कंजेनाइटल मतलब बर्थ टाइम से ही हो तो उनका मिनिमम कितने एज से मोतियाबिंद ऑपरेशन हो जाता है?
मिनिमम नहीं सर, जब हम डायग्नोस करेंगे तब तुरंत उनको ऑपरेशन करना पड़ेगा सर.
अच्छा, ऐसा नहीं जैसे 1 साल के बच्चे का 2 साल के बच्चे का इनका भी हो जाता है क्या?
नहीं, हाँ सर हो जाता है सर. करना पड़ता है सर.
अच्छा, तो बाद में फिर इनका लेंस अगर जैसे उनका ग्रोथ होता है तो क्या लेंस फिर बदलना पड़ता है?
हाँ सर, उनको क्या है कि पहले हम अगर 2 साल से कम है तो उनको नॉर्मली हम लेंस नहीं डालते सर, तो लेंस बाद में डालते सर उनको.
अच्छा,
ग्रोथ होने के बाद.
ग्रोथ होने के बाद.
जी बिल्कुल.
तो अगर 2 साल पे अगर उनको लेंस डालेंगे तो क्या फिर आगे जाके बदलना नहीं पड़ेगा?
नहीं सर, उनको क्या है कि अभी 2 साल में वो लेंस पिटाने के 2 साल के पहले अगर मोतियाबिंद है तो मोतियाबिंद ऑपरेशन करने के बाद हम उनको थोड़ा सा मोटा चश्मा देंगे. तो उनको चश्मा देंगे, तो चश्मा देने के बाद वापस थोड़ा बड़े उम्र होने के बाद तब हम लेंस डालेंगे सर उनको.
तो क्या बच्चों के लिए कोई अलग लेंस आता है कि वही पड़ता है सर जो अडल्ट के लिए होता है?
वही पड़ता है सर, बच्चों के लिए अलग नहीं होता, वही पड़ता है. लेकिन क्या है कि बच्चों में वो लेंस सूट नहीं होता सर, क्योंकि लेंस थोड़ा बड़ा साइज रहता है. तो इसलिए बच्चों में क्या है कि हम लेंस नहीं डालते, थोड़ा मोटा चश्मा देते ताकि वो देख सके.
तो उसके बाद में फिर लेंस डालते हैं.
एग्जैक्टली.
Sir, when is the ideal time to operate?
Sir?
When is the ideal time to get operated for cataract?
Sir, when you feel there's any glare in the eyes, when you feel that vision is not 6/6, in spite of using glasses, if you feel the vision is not 6/6, then it is a good time to go for surgery, sir.
Okay. Thank you.
Welcome, sir.
Sir, is there any chance after getting operated again the cataract will develop? Is there any chance?
No, sir. Cataract once is done, it is done, sir. It's permanent, sir.
Thank you.
Welcome, sir.
Adab, sir.
Sir.
सर ये जो है कैटरेक्ट सर्जरी, इसके बाद रोशनी आने के कितने चांसेस हैं?
सर 100% चांसेस है सर, क्योंकि हम कैटरेक्ट करते हैं रोशनी इंप्रूव होने के लिए, क्योंकि वो मोतियाबिंद की वजह से हमारा रोशनी थोड़ा कम हो जाता है, तो हम सर्जरी कर रहे हैं रोशनी बढ़ाने के लिए।
सर इसमें कैटरेक्ट में लेंस डालना जरूरी है क्या?
बिल्कुल सर, अगर लेंस डाले तो ही हमको क्लियर दिखता है सर।
क्या ऐसे भी चांसेस है कि कैटरेक्ट हो लेकिन लेंस ठीक हो, ऐसा हो सकता है?
कैटरेक्ट हो लेकिन
लेंस ठीक हो?
लेंस क्या हो?
ठीक हो सकते हैं लेंस, अगर
ठीक
अगर
होने का मतलब?
कैटरेक्ट हो, मतलब मेरा कहने का मतलब यह है कि लेंस डालने की जरूरत ही नहीं हो,
सर अभी
ऐसा हो सकता है?
सर अभी क्या होता है कि सिंपल मैं बताऊं आपको, आंख के अंदर लेंस रहता है सर, वो लेंस की वजह से आपको रोशनी दिखाई दे रहा है। ये लेंस नॉर्मली ट्रांसपेरेंट रहता है, लेकिन उम्र की वजह से ये लेंस सफेद होता है, उसको हम कैटरेक्ट बोलते हैं। क्योंकि हम लेंस निकाल रहे हैं, लेंस बिठाना पड़ता है। अगर लेंस नहीं डालेंगे तो आपको चश्मे की जरूरत, बहुत मोटा चश्मा की जरूरत पड़ेगी आपको।
सर
तो
लेंस ये ऑपरेशन का कितना बनता है ये पेमेंट?
सर ऑपरेशन आपको सर्जरी, लेजर सर्जरी आपको 25-30 हजार से शुरू होकर 1 लाख तक जाता है सर, वो लेंस के हिसाब से रहता है सर।
ओके सर, थैंक यू।
वेलकम सर। What about cataract eye drops? See, cataract eye drops are basically, these are again eye drops. This is not going to prevent cataract, but these are eye drops. They say that it will delay the progression of cataract. So there is no medicines or tablets or drops which will prevent cataract. The only treatment for cataract surgery till date is only surgery.
एक और बार सर,
सर
एक बार कैटरेक्ट सर्जरी करने के बाद क्या ऐसा चांसेस है कि दोबारा कैटरेक्ट हो सकता है?
नहीं सर, नहीं होता सर। नहीं
कभी
सर।
नहीं? श्योर?
यस सर।
ओके, थैंक यू सर।
Is there anyone to ask any question?
सर इसका कुछ कॉम्प्लिकेशन रहता है आफ्टर सर्जरी?
सर अभी मोतियाबिंद डिपेंड्स अपॉन द कैटरेक्ट सर। नॉर्मली कैटरेक्ट सक्सेस रेट इज मोर देन 99.5 0.5%। अगर कैटरेक्ट बहुत आप लेट स्टेज में आओगे, जैसे कि हमने बताया इस प्रेजेंटेशन में, अगर लेट स्टेज में आ गया, बहुत मोतियाबिंद बहुत पक गया, तो लेंस बिठाने का जो सपोर्ट रहता है बहुत वीक हो जाता है। तब उन जैसे पेशेंट को हम 1 महीना रुकने के बाद लेंस बिठाना पड़ता है। तो इसलिए जितना जल्दी हो सके करेंगे तो आपको भी आसान रहता है, एज अ सर्जन, सर्जन को भी आसान रहता है। एज सच ज्यादा कुछ कॉम्प्लिकेशन होने की जरूरत नहीं है सर, इट्स अ वेरी सेफ प्रोसीजर।
सर कौन सा एज रहेगा जिसमें कैटरेक्ट करना चाहिए?
सर ये एज के हिसाब से नहीं है सर, जब भी आपको लगता है कि आपका रोशनी कम हो गया है, चश्मे के साथ भी अगर आपको रोशनी उतना क्लियर नहीं दिख रहा है, मोतियाबिंद आ गया, तो ऑपरेशन करना जरूरी है सर।
अच्छा अच्छा, थैंक यू।
वेलकम सर।
హలో సార్. సార్ రిపోర్ట్స్ అంటే ఏం లేదండి, సర్జరీ చేసింది ఇవే సార్, పెద్ద డ్రాప్స్ రాశారండి. నేను
सर
కార్నియా రిపోర్ట్ అంటే ఏం ఇవ్వలేదండి సార్.
सर
కార్నియా టెస్ట్ ఇది స్కానింగ్ చేశారు కానీ రిపోర్ట్ ఇవ్వలేదు సార్.
సార్ మీరు రిపోర్ట్స్
హలో.
ఏది ఉన్నా కానీ ఒకసారి నంబర్కి పెడితే చూసి చెప్పగలుగుతాం సార్. అది అంటే చూడకుండా ఏం చెప్పలేను సార్ అది.
అంటే సార్ ఇప్పుడు వాళ్ళు ఓన్లీ సర్జరీ చేసింది లెన్స్దే ఇచ్చేసారండి. అంటే
అదే సార్, అంటే
మిగతాదంటే
మీకు
ఈ డ్రాప్స్ అవి రాశారు సార్.
సార్
డ్రాప్స్ అవి రాశారండి.
అదే సార్, అంటే మీరు నాకు చూడకుంటే నేను చెప్పలేను సార్ ఎగ్జాక్ట్లీ ఏంటని.
Muhammad sir is online. He has raised the hand. Ask your question now, sir.
सर हेलो।
Yeah.
सर जैसे अभी कॉन्जेनाइटल कैटरैक्ट के बाद अगर एफेक्टिक छोड़ने के बाद जो एम्ब्लोपिया डेवलप हो सकता है उसको?
क्या सर?
कैटरैक्ट सर्जरी कॉन्जेनाइटल कैटरैक्ट सर्जरी करने के बाद एफेक्टिक छोड़ देते हैं ना सर?
क्या छोड़ देते हैं?
एफेक्टिक आई।
किनको छोड़ते हैं? बच्चों को बोल रहे हैं आप?
जी सर।
जी।
तो उसमें एम्ब्लोपिया डेवलप हो सकता है?
हाँ सर, इसलिए एम्बेलोपिया डेवलप होने का चांस रहता है, इसलिए हम मोतियाबिंद का ऑपरेशन जितना जल्दी हो सके करना पड़ता है। और क्योंकि एम्बेलोपिया नहीं होना है और एफिया छोड़ने के बाद हम कॉन्टैक्ट लेंस या स्पेक्टिकल्स देते हैं सर बच्चों के लिए, ताकि एम्बेलोपिया ना डेवलप हो।
ओके सर, ठीक है सर, थैंक यू सर।
वेलकम सर।
Please ask your question. If anyone wants to ask any question, please just unmute yourself and ask.
If there are no other questions, anyways, if there are any more questions, I think you can reach out to Easy Treatment. And if there's any further this one, we can just get in touch with Easy Treatment, and then we can address any of your issues. So, thank you so much for everyone for your patience hearing, and thank you for making this session interactive. Thank you, Karishma. Thank you, Easy Treatment.
Thank you, sir. Thank you, doctor. Actually, we have some special offer for our attendees who have joined today. You can get free screening, and you can also get 20% off for treatment if you will book your appointment with us. Just you have to call, or you can just WhatsApp us with the same number. Our number is 900001766. So our team is there.
Thank you.
They'll be available for you anytime. So thank you for being with us today, and we are always happy to help you on your better health. Thank you so much.
Thank you, ma'am. Thank you.